8:30 our time at 950 KWAT. I'm going to talk with Joe Bretschneider. He's a PA with Prairie Lake's Urology here in town, and talk with him about prostate. Good morning, Joe.
Good morning, Randy.
First off, the importance of detecting prostate cancer early on.
Yeah, it's big. We usually come with the idea that prostate cancer is just super common. 1 in 8 men are affected by it. It's actually the most common solid malignancy in men. And it's one of those things, if detected early, it's got a very favorable outcome, like over a 99% survivability if caught early. After it metastasizes, then the rate of survival actually drops significantly down to like 30% or so. Like I said, again, very survivable over 5 years, but again, it's one of the reasons why we want to detect something like this early, and that's what we could talk about is how to detect it and how to screen for it.
Now, I know PSA, I have PSA tests all the time. That lets me know where it's at. That's very important to have a PSA test. Get that one scheduled because that's one that's going to keep you on track.
Absolutely, yeah. That's really the hallmark behind all of our screening. It's really a non-invasive test. It's just a simple blood test to have done. And if you've got a primary doctor, oftentimes they're doing it. If you don't, we're happy to take care of that too. Typically, men should start getting that PSA test done at some point in their 50s, mid-50s for people that don't have any risk factors. That's a good time to at least start this screening process. If there is a pretty strong family history of prostate cancer, you may want to consider starting that sooner. Often, sometimes even into your mid-40s wouldn't be a bad idea. But yeah, that's about what we're looking at for most men. And I mean, this cancer on average tends to affect most guys in their 60s. That's the mean age. But if we could start certainly screening in your 50s, that gives you a better shot to catch it early.
As you mentioned, just a simple blood test, and then they give you what the reading is. If it's in that certain range, no worries. But if it gets in that upper range, then it's something to really think about.
Yep, yeah. So and that range can vary. Yeah, certainly every guy will get their number at some point, and we'll often like to trend those numbers too over a period of time, and that can tell us if there's something that looks suspicious or not. And certainly as we age, there's also a condition called benign prostatic hypertrophy, or BPH, is what you sometimes hear about. That's basically just normal prostate growth over a person's lifetime. And a condition like that can even affect 90% of guys. Sometimes we can even see a rising PSA just related to an enlarging prostate. It's our job to determine whether that's what's causing the PSA to go up or if it's something more concerning like cancer. So that's what we look to tease out when we start seeing patients with elevated or rising PSA numbers.
For some guys, nothing's going on with me. I'm feeling fine. They're still going in and getting those tests. But what would be some of the symptoms that we should be looking for prostate cancer?
Yeah, and that's the interesting thing. There really isn't any symptoms early on with it. Most guys feel fine. It's not until symptoms are really a late sign of that, too. Certainly plenty of symptoms that go along with an enlarged prostate. So you may have some troubles urinating or emptying your bladder, or you maybe notice a weak urine stream or any of those type of issues, or even urinary frequency and urgency. A lot of those are just symptoms of an enlarged prostate. Now, it may not necessarily mean you have cancer, but it may be a good reminder that, hey, we should start looking into this problem. Like I said, otherwise, late signs of prostate cancer could be even things from weird, interesting pain into your pelvis and lower back and just, again, late signs. But, again, one of those things where you may not have any symptoms. So that's, I think, where I can stress the importance of just getting screened.
Yeah, the late signs, we don't want to get to that point.
Yeah, we won't talk about those.
No, we want to catch it early. So main thing you mentioned, get the PSA test. It's basically, like you said, your normal doctor, simple blood test, if they keep on track of it. But if they see elevated levels, they're probably going to tell you to schedule an appointment with urology, I would think.
Yeah, and we're pretty accessible. It's myself, Dr. Maxwell's a urologist up here, and then we have another PA, Abby Wookie. Between the three of us, we've got pretty good availability. We can generally see people within a week or two of the referrals. We're pretty easy to get a hold of, and I think we're pretty easy to get along with, too.
I hope so.
So...
And it's good to have it done in town. I want to mention that. You don't have to go to the big city of Sioux Falls. It can be done right here because you've got a great facility here in town to get this taken care of.
Absolutely, yeah, and that's the cool thing about Watertown. I've actually been with this group now for maybe about a year and a half or so, but it's incredible the amount of resources we have in a town the size of Watertown. And like I said, it's pretty neat what Prairie Lakes does to get that type of access in such a small community. We can pretty much take care of all of the biopsies, diagnoses. Even a lot of the treatments can be done through the cancer center. We pretty much do everything except for we aren't doing any prostate removals here in town. A lot of those are all done robotically now, just by the standard of care, and we're just limited by not having a robot at our facility. But other than that, we could take care of pretty much everything related to prostate cancer.
Could you ever see a robot come and take care of it here in town, or is that just
that's
strictly down there?
That's going to be up to some of the people at the hospital. I think we're going to have to see the volume to necessitate something like that too. But who knows? If in the future we could, if they become more accessible and maybe more affordable, and we could just see it benefiting us. But like I said, possibly. It's hard to say.
It's a spendy piece of equipment,
Right.
Definitely. Yeah.
And there's a lot of technology involved with that too. And not going to probably begin to tell you the ins and outs of that because I might be talking over my head then.
So anybody that's got any concerns, set up an appointment with their doctor, or again, if they have any questions with urology, you're easy to get a hold of and answer those questions too.
Yep, absolutely. So yeah, we're available. Our office hours are Monday through Thursday. We're here from 8 to 5. Friday mornings we're pretty accessible, and we can usually be accessible Friday afternoons by appointment too.
Oh, even follow-ups, even if you've had the procedure done, that's a good place to have the follow-ups too, to be still on top of it.
Yep.
PrairieLakes.com's a website they can go to. Did you mention phone numbers? I know you mentioned hours. Did you mention numbers for urology?
Phone number to the specialty clinic here, 605-882-7777. Again, 605-882-7777.
You guys out there, make sure that you get the test done, especially when you talked about the age range to be looking for it or any of those symptoms or whatever might be detected. We want to be on top of it early.
Absolutely.
All right, Joe, thank you for being on KWAT and talking about this very important part of our health.
Yeah, absolutely. Thanks for having me, Randy.
You enjoy your day.
Thanks, you too. Bye.